Coming up on the program, we explore two powerful health challenges, one rooted in preventing harm, that is gun violence, and the other in promoting lifelong wellness in the form of breastfeeding.
Support for What's Health Got to Do with It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org. Rethreaded knows human trafficking destroys lives, but they also know it's not the end of the story. Rethreaded believes in the potential and power of all survivors to reclaim their lives. Visit rethreaded.com to learn more. And Elevate Med. Through mentorship, leadership development, financial literacy, a robust peer network, and tuition-based scholarship support, Elevate Med is dedicated to the next generation of diverse physician leaders as a tangible step towards the eradication of health disparities. More at elevatemed.org.
From the moment we're born to our last breath, every American embarks on a journey through the intricate maze of the healthcare system. These are their stories, one life at a time. Today, we meet typical patient Peyton. Peyton is a 3-year-old boy who arrives in the emergency room with a gunshot wound to the chest. There's no intruder, just a frantic family and a loaded handgun left in a bedroom closet. His 6-year-old sibling, Maddie, thought it was a toy. There was no lock, no secure storage. The injury wasn't random. It was preventable. What caused this life-threatening trauma? Hi, I'm Dr. Joe Servin, a practicing neurologist at Mayo Clinic, professor of healthcare administration and policy at Arizona State University. This is What's Health Got to Do with It, which looks at where and how healthcare intersects with your life, helping you get the medical answers you want. Now let's turn our attention back to Peyton. The diagnosis, an unsecured firearm injury in a child. Tragically, stories like this one are far too common. Guns are now the leading cause of death for children in the U.S., surpassing car accidents and cancer. To help us understand how safe storage can save lives, we're joined by Dr. Catherine Hoops. She's a pediatric critical care physician, director of clinical programs and practice at the Johns Hopkins Center for Gun Violence Solution. Dr. Hoops, she's joining us from Baltimore. Welcome to our program.
Thank you so much for having me.
It's so good to have you here. I know that you treat the youngest victims of gun violence firsthand. And I'm wondering, as a doctor, how has your work in the ICU shaped your mission at the Center for Gun Violence Solutions?
Oh, in so many ways. As a pediatric critical care physician, just like the story you described, I see the tragedies that can happen when kids get their hands on unsecured firearms. And it may be that curious toddler, or it can be a teen in crisis. These kids can get seriously injured or killed. And seeing those kinds of injuries all too often in our ICU really informs the work that I do. And that's why a lot of my work, my teaching, is focused on secure firearm storage, right? Because ultimately, gun safety starts with safe storage, and safe storage can save lives.
The statistics are sobering. It even kind of like took me a little off guard as I was kind of stating it, that guns are now the number one cause of death for kids. What does that kind of tell us about the urgency of preventing this from happening?
Oh, I think that it absolutely underscores the urgency, right? Kids should not be dying. They should be growing and developing healthy, And we, all want to be working toward a future where that's the case, right? Where kids have the ability to exceed their wildest dreams. And so I think that the fact that firearms are the leading cause of death in children and in young people really underscores the immediacy of the problem. And there are many things that we can do to prevent injuries, but we think that especially safe gun storage is really critically important. Right? We want our kids to be safe and injury free, but we also know that most gun owners, unfortunately, do not store all of their firearms safely, including more than half of gun owners in homes with kids. And so kids are being exposed to risk in their homes. And especially important to think about now, during the summertime when kids may be at home more than during the school year. But part of the public health approach to injury prevention is, the idea that we can put barriers in place, right,
Sure.
to interrupt that pathway from exposure to injury to crisis to injury. And safe storage is exactly that, right? By safely storing firearms, we can prevent harm to that curious toddler, and save lives by doing that.
What are the key components that every household who has a gun should understand about that concept of safe storage? A part of me says it sounds so simple on one level, but maybe there belies a complexity here that I don't fully grasp. What are those components that folks with guns in the house should know?
Yeah. No, thank you so much for asking. And it's a simple step, but it can actually be quite challenging to implement. And that's why having these conversations is so important, so that we support gun owners in the resources that they need to do so. So what is safe storage? The best way to store your firearm at home is locked, unloaded, separate from ammunition.
Mm.
The central goal here is to make sure that your firearm is inaccessible to unauthorized users. Um, so that might mean using external locking devices. It might mean using a safe. And one of the challenges here, I think, is that oftentimes, not always, but oftentimes, people own firearms for personal protection, for home defense. And so having quick access to their firearm is really important to them. So we want to make sure that we're providing resources that still allow them to have that gun for that reason in a way that feels safe and appropriate to them, but also prevents unauthorized users from getting access to it. Right, so you can use a quick access safe to secure your firearm, and still have quick access to it if you need it. But really, again, the message is that we want all firearms to be inaccessible to unauthorized users by locked, unloaded, secure storage. And that can really be life-saving and not inconsistent with owning firearms for personal protection.
So many families think that storing a gun out of reach is enough. In other words, I'm going to hide this at the top of a shelf or something along those lines. And I know you've just kind of discussed how it's separating the pieces, the ammunition versus the gun itself. Um, from your perspective in pediatric critical care, because you see the stories, why do you think just putting it out of reach isn't enough?
Oh, our kids are curious and they're smart, right? So they find the treats that we hide as parents. They
Yes,
find their
yes.
birthday presents. They're curious, they're smart, and they will find potentially lethal weapons even when they are hidden, on a high shelf in a closet, in the back of the nightstand. In fact, we know that even when parents think that their kids don't know where the guns are being stored, the majority of the time they do. So it's extra important. Certainly, you can still do those things, but the firearm needs to be unloaded and secured with a safe or a locking device, in addition to being kept in a place that's out of reach. But keeping a gun on the top shelf in the closet is not sufficiently secure because our kids are smart.
And it makes perfect sense because, I mean, as you said, they find the Christmas present, they find these other things. Uh, I'm going to get into, like, so this is one of those topics that sometimes it reels right on that line in policy and politics and medicine. So you're not only just a physician, but you're also trained in law and public health. Talk to me about how your unique perspective, because you have these different lenses, approach what seems to me as very common sense, but very can be very emotionally charged topic.
So I think that secure storage in particular is, even at a time when these topics might feel like a something on which we don't agree on many aspects, but really, across the spectrum, we agree on this. Right. There's no divide
Mm.
on wanting our kids to be safe and healthy, and similar. Most Americans agree that requiring secure storage of firearms when those firearms are not in the direct use or control of the adult gun owners is a good thing. Um, so as far as, the popularity of laws compelling safe storage, those are popular. Support is bipartisan. And, we know that those laws are effective, right? We have decades of rigorous research, showing us that safe gun storage saves lives. This data consistently show us that secure storage prevents homicide, suicide, unintentional injuries, and gun theft, right? Hundreds of thousands of firearms are stolen every year, but states with secure storage laws see lower rates of stolen firearms, especially from vehicles. So, we know that this intervention is popular and acceptable. We know that, the safe storage laws are effective in reducing injuries. But ultimately, you don't need a safe storage law in your state to practice safe storage, right? These are still conversations that we can be having with our friends, our family members, to support this practice in our homes, regardless of what policies may or may not be in place in someone's state. Right, we can be having conversations before play dates about how guns are stored in the home. We can be having discussions with our family members, in order to really just normalize this is one of the things that we talk about home safety and keeping our kids safe at home.
And to all of our listeners out there, you're listening to What's Health Got to Do with It on WJZT News 89.9. I'm Dr. Joe Servin, and if you're just joining us, we are talking about looking at gun violence from the standpoint of health. And we want to hear from you. If you have an idea for future shows, tag me on social media at Jay Servin. Dr. Hoops, Florida, where the show's produced, Georgia, which is also in our radio market here, are among 26 states with some form of child access or safe storage laws. Are these laws, from your vantage point, are they making a big difference when you look at it to a state that does not have that type of law?
They absolutely make a difference. And one way in which those laws help is by starting a conversation about safe storage, right? By encouraging, even at the point of sale, to be talking about, the laws that require safe storage in the state. They help to encourage the availability of resources around safe storage. Um, so we know that safe storage laws work, and in fact, we have a lot of research and some more information about safe storage and child access prevention laws on our website. But again, a lot more can be done, right? I mentioned before that, more than half of gun owners in homes with kids don't secure all of their firearms safely all of the time. Um, so I think that's where having some of these conversations really becomes important, right? That, laws are, like this are going to work better when we have more normalization of this behavior in our communities, right? That this becomes not only an accepted behavior, but the norm, right? We're encouraging everyone to do this as just a central tenet of, responsible gun ownership. So the laws are helpful. They've been shown through research to reduce firearm injuries. They help to start conversations and share education about safe storage. But there's certainly more that we can be doing, as a community to normalize safe storage in our communities, because we know, again, that safe storage can be life saving.
Talk to me a little bit about, okay, great. We know that it's a big deal to get these laws passed, but there's also that other piece, which is following the laws. What does enforcement look like? Is that enough?
I think, in enforcement of child access prevention laws is challenging. Because often noncompliance only comes to light after a tragedy. So, we know that stronger child access prevention laws, those with penalties for noncompliance, are associated with bigger declines in injuries due to firearms in the states that have them. But it's challenging to enforce. That's why one of the things that we're encouraging, through our organization, through the Center for Gun Violence Solutions, is more information sharing about how these laws are being enforced, so that we can better understand how to promote compliance.
How do you approach a conversation with gun owners who, especially parents who are gun owners, who may be resistant to changing how they store their firearms? What's the approach in meeting these folks where they are?
I think, just like any potentially challenging conversation that we have in our clinical practices, right? We want to go into every conversation with an open mind, with a patient and family centered lens, right? And just try and understand where our patients are coming from, right? Why is it important that they store that gun in that way? How can we support them in doing that, the thing that they think is important, while also doing something that will help to prevent unintentional injuries in their homes, or protect the kids in their homes? Because again, you can do both. I think that, the mistake that we sometimes make is being overly prescriptive in, what we are encouraging patients and families to do, before we really seek to understand their perspective,
Mm.
right? But I think if we are going into these conversations, asking more questions first, right, to better understand, their decision making thus far about the storage of firearms in their homes, then I think we can arrive together at, a safer practice in which they've had more autonomy in making decisions about how to implement in their home, right? So rather than just saying, this is what you need to do, this is the safest thing, really trying to understand their perspective, and arrive at a solution that seems most feasible for them, right? Because ultimately, the storage device or storage practice that your patient or family chooses is the one that they're going to practice routinely, right? and
Mhm.
and again, one of the things that we want to emphasize, that this is important to do, not just at the end of hunting season, right, but every gun, every time,
Right.
so that we're consistently implementing safe storage behaviors.
Have you seen examples either in your clinical work or through the center's work where this education, the safe storage education, directly prevented a tragedy?
Absolutely. I mean, I think that, the counseling around safe storage, especially as a potential means of preventing suicide, um, you know, there sometimes you can see a closer connection in time, right? Um, Oftentimes as a clinician, you're providing a ton of counseling and, you know, not sure what happens. You're providing counseling about baby proofing and swim safety and all of these things. It's hard sometimes to see an immediate connection, to know that I provided this counseling and this behavior was implemented and this happened, right? That doesn't, on a systemic level, though, we know that these things are important and they are life-saving. And so still important to be doing as part of our routine practice, even though sometimes it's, you don't immediately see the effect.
Dr. Hoops, in our final moments here, for our listeners who are out there and they may be wondering, maybe they own a gun, maybe they don't, maybe they don't have kids at home, but what's that one step that you would say they can take today to make their home safer for everyone with regards to safe storage of guns at home?
Everyone has a role in the promotion of safe storage, right? If you are a firearm owner and you are currently storing your firearm securely, right, unloaded, locked, separate from ammunition, then maybe the next thing you can do is go and talk to a friend or family member who may not be practicing safe storage, right? If you are not yourself a gun owner and you have a child who's going over to a friend's house for a play date, you can feel empowered to ask about the storage of firearms in the homes that your child visits and plays at. And if you are a gun owner who does not currently secure all of your firearms, please take steps to get a secure storage device like a keyed lockbox, a quick access safe, or even a cable lock. But your first step is to go unload that firearm. That can be preventive against suicide, homicide, unintentional injuries, especially in youth. But also preventive against theft of firearms, which is a really important portal of entry for crime guns, right? So safe storage not only keeps guns out of little hands, but it can also keep guns out of the wrong hands too.
One question that we have from a listener, and they wonder, what should we be teaching kids about gun safety? When and what should we be doing with that part of this?
I think the most important thing is that any education about firearm safety is tailored to an individual child and their development. And this is going to look very different in different settings for different families. But, I think the central message for littler kids, right, is, you don't touch it, tell an adult, right?
Right.
And as kids get older, then we can start talking about, principles of, safe storage and safe handling. Maybe, hunting is important to, an adolescent family. So we can start having these conversations with younger kids in a way that's developmentally appropriate. But I want to be sure that kids as young as 3, 4, 5, younger kids, even though they may have received, some kind of teaching from, a parent or a family member not to touch firearms, again, this is not adequate to protect them against injuries, right? We still need to be taking that extra step for safe storage. And then each family will figure out what makes the most sense for them in their homes and with consistent with their values and their child's developmental level about how to talk about gun safety in addition to practicing safe storage in their homes.
Dr. Hoops, I want to thank you so much for giving us your time today. I know you're busy. I know you're actually on call while you're doing this interview with us. And so we are incredibly appreciative of you giving us this time on such a hugely important topic. We really, really appreciate it.
Really appreciate y'all. Thank you so much for having me.
You bet. We've been talking to Dr. Catherine Hoops. She's a pediatric critical care physician, Director of Clinical Programs and Practice at the Johns Hopkins Center for Gun Violence Solutions, and she joined us from Baltimore. Coming up, we'll be talking about breastfeeding, and we'll be right back after your health headlines. Hey, it's Dr. Joe Servin. I have a new show called This Week in Health, and it's part of WJCT News Now. Local news you can listen to anytime, anywhere. When you sign up, you'll unlock 4 local podcasts delivered straight to your podcast app. I break down the week's biggest health headlines and what they mean for you. Start a free 30-day trial at wjct.org/newsnow. And if you like it, become a monthly donor to support WJCT Public Media.
Hi, I'm Stacey Bennett, producer of What's Health Got to Do With It, and these are your weekly health headlines. A sharp decline in childhood vaccination rates is opening the door for the return of diseases currently considered under control or eradicated. Recent outbreaks of measles have been signaling a concerning trend. According to the CDC, vaccinations are declining in more than 30 states for diseases like measles, mumps, rubella, chickenpox, polio, and pertussis. U.S. public health officials say if vaccination rates continue to fall, the country could face millions of infections that were once considered under control. Amid the nationwide debate on Donald Trump's signature tax law, digital health companies are seeing potential benefits. The law provides first-dollar coverage, a permanent extension allowing high-deductible health plans to cover telehealth services. This is all effective for plan years that begin after January 1, 2025, reinstating the pandemic-era relief that expired at the end of 2024. While other healthcare sectors criticize the new legislation, telehealth companies welcome it. Emerging research suggests that dogs can sniff out Parkinson's from the oils on skin. While there's no early detection test for this disease, 2 dogs were trained to successfully distinguish sebum from patients with and without Parkinson's. Sebum is the oil that skin produces to protect itself from becoming dry. The dogs demonstrated sensitivity of up to 80% and specificity of up to 98%, using samples from 60 controls and 40 drug-naive Parkinson's patients. Although more research is needed, skin swabs could be the solution for early detection. And for some good news, gentle exercises like Tai Chi or yoga may help with insomnia, a sleep disorder that makes it hard to fall asleep, stay asleep, or get restful sleep. It affects nearly 15% of American adults each month. Researchers found yoga improves sleep time by 2 hours, and combining aerobic exercises help people fall asleep 30 minutes earlier. And those are your weekly health headlines.
Welcome back to What's Health Got to Do With It. I'm Dr. Joe Servin, and now from protecting children to nourishing them, we turn to the benefits of breastfeeding and why support for nursing parents matter more than ever. Let's meet Maya. At 6 weeks old, Maya had her first wheezing episode. By 4 months, she was diagnosed with eczema and missing developmental milestones. Her mother, overwhelmed and unsupported, had switched to formula after struggling with breastfeeding. Only later did she learn about some of the protective benefits of breast milk, but no one had told her, and no one had really helped. What's going on with Maya? The issue: lack of exclusive breastfeeding. Breast milk can offer powerful health benefits, but support, education, and access matters just as much. Many families face barriers that prevent exclusive breastfeeding, and too often they face those challenges alone. Joining us now to talk about all of this is Dr. Diana Taft. She is an assistant professor of food science and nutrition at the University of Florida. She has new guides that aim to inform and empower families without judgment. She recently just delivered a new baby. Congratulations, Dr. Taft. But it's a joy to have you on our program with us.
Thank you very much for having me. This is one of the few topics I think is important enough to interrupt my maternity leave. So I'm thrilled you're interested in talking about this.
Well, we're excited. And again, congratulations. And clearly you're speaking from a place of experience as you talk to us today. Let's start us off. When it comes to breast milk and lactation, there's just a certain amount of time that someone is lactating after they delivered a baby. Tell us, in terms of like the folks who are listening to this, who are the ones that maybe can process this information separately from someone who, may be in exactly the same shoes you're in right now?
So 70% of women will experience some type of problem with lactation. So first of all, if you are currently trying to breastfeed your child and you're having an issue, you're not alone. It's very common. What you need to know is that time is of the essence. It's a crisis. Don't sit here listening to me about the benefits of breastfeeding. You need to turn this off. You can come back to it later, and you need to find help with lactation now, because in a crisis, biggest gift you can give yourself is time. So the sooner you get hold of a lactation consultant, and you can go to ilca.org, that's International Lactation Consultants of America. They have a tool to help you find a lactation consultant near you. You can go to your OB, you can go to your pediatrician, but the sooner you start to get help, the more likely you are to succeed at reaching your breastfeeding goals. So come back to this later, but go get help now.
I love that. But we do want you to listen to the show, but I like the way you're framing it. Let me get to a very basic question. One that often is asked by many people, which is, what is the big difference between breast milk versus formula that you get from a medical office or you purchase? What's the big difference between formula versus breast milk?
Well, the good news is formulas are highly regulated in this country. So a formula will have everything an infant needs to grow. The key difference is breast milk is what's called a complex biofluid. And what that means is it's really complicated and it does a lot of different things, and it's a liquid that comes from a living source. So if you look at breast milk, changes in composition from the start, when you start feeding to when you finish feeding. It changes in composition over the course of a day. It changes in composition over time as your infant grows older. So it's constantly changing to meet your infant's needs. It has components to it that we cannot put into formula. So it has immune cells, it has antibodies. Your breast milk becomes part of your baby's immune system. So that's really important to how it functions. And we cannot replicate that change over time. We cannot replicate that change from the start of a bottle to an end of the bottle with formula. So breast milk has a lot of a time component to it that we can never replicate. And some of that time component can matter quite a lot. So there are things like melatonin that peak in breast milk when you want your baby to be sleeping. Formula is always the same thing. It's never going to adapt to your baby's needs.
Interesting. There's you're talking about time. We often hear the recommendation that a mom should be exclusively breastfeeding for 6 months or so. The reality is maybe a quarter of families in the U.S. can do that. My big question, why is this goal so hard to reach? Talk to us a little bit about that part of this.
Really, really do not support breastfeeding parents in this country. So if we look at different countries around the world, besides the US, there are only 7 countries in the world that offer no guaranteed paid maternity leave. So we keep company with Papua New Guinea, Suriname, Micronesia, the Marshall Islands, Tonga. I think we can probably do a little better on paid maternity leave. I know of people who had to go back to work after 1 week. You don't even have time to heal from the delivery after 1 week because the company they worked for had fewer than 50 employees, so they weren't covered by the Family Medical Leave Act. The company did not provide paid maternity leave, and all that was available was 1 week.
Mm.
You can't establish lactation in 1 week. You need more time. And really, you need 3 months because babies have to learn how to breastfeed, mothers have to learn how to breastfeed. You need time to build supply, you need time to deal with issues, and you need maternity leave because you need someone else to help take care of mom while she works through some of the lactation issues. And without that sort of very baseline level of support, it's hard to build the supply you need to fully breastfeed. On top of that, we don't really provide support for lactating women in public spaces.
Mm.
Our default as a culture is to treat formula feeding as the norm. So if you look around in the building you work in, where's the nearest lactation room? I was a little bit surprised when I started at University of Florida because having worked in this kind of research in Ohio and in California, it was where's the nearest lactation room in case we need to bring in breastfeeding women to study something time sensitive about breast milk.
Sure.
In Ohio, it was literally the room next to the lab, so score us.
Right.
And in California, it was 2 doors down. It's a 15-minute walk to a different building where I am at University of Florida.
Wow. Let me ask that, since we're talking about states and you just brought up a couple, what about Florida? We are there. You work for University of Florida. I know they say the quoted rate of exclusive breastfeeding just over 18%. You just brought up Ohio and California. What about the state of Florida? What can you comment about that in terms of these barriers and challenges here?
We have a lot of work to do.
Okay.
Because when you look at our breastfeeding rates, we're number 48 in the nation.
Oh, wow.
Love Florida. I think we could be number 1, but we really have some work to do. And the first thing we need to do is sort of address maternity leave, paternity leave, and make sure that people can actually take time to establish lactation. And this really needs to be, in some ways, a community effort because each of us have something we can do. Look around. Is there a lactation space in the building you work in? Are you in a position that you could advocate and ask for one that is not a bathroom? Because if you wouldn't want to eat your lunch in a bathroom, why are we asking mothers to prepare their baby's lunch in a bathroom? We can also think about what it means to lactate in a public space. Because if you're breastfeeding a baby, it's Florida, it's hot. If you're covering them up, the baby overheats. And when you're breastfeeding, sometimes babies get distracted and they come off the nipple. And having that kind of exposure in a conservative state can be viewed as offensive. So we need to sort of start to change the narrative around that. And we have to make it very normal and very acceptable of you can breastfeed your baby wherever it's appropriate for a mother and baby to be together. And it's going to take time and it's going to take thought, but I do think it's doable.
You brought up at the beginning when you were talking about the difference between formula and breast milk, kind of some of the things that the newborn needs in general that's kind of unique for the baby at that time. Walk us through some of those known health benefits. It seems in this day and age, it's all about people making their own informed choices since they have a lot of different ways of getting information. Walk us through some of those just the positive known benefits of breastfeeding without adding any pressure to someone who opts not to proceed this way?
So I am going to flip that around a little bit,
Sure.
and I'm going to say it's actually risks of formula feeding.
Okay.
Because the baseline system for human beings is to breastfeed. So if you think about formula as an over-the-counter medication, if your baby were running a fever and the doctor said give Tylenol, you don't think twice about it.
Right.
If you are unable to lactate, and I'm going to be totally honest, there's about 5%, so 1 in 20 women, who will not be able to lactate.
Okay.
You give formula because that's what we have available. But when you talk about it as a choice, that's a little bit problematic because you don't actually give a lot of families a choice. We could build a system where we had donor milk available for women who struggle with low supply and just need a little bit to bridge. I lived through that. I'm lucky I had a friend I trust with my baby's life who was also lactating. So I was able to get some breast milk to bridge to when my full milk came in. Not everyone has that. Not everyone has the access I had to a lactation consultant. Not everyone has the time to respond. And what kept haunting me during that period of low supply is the fact that 720 term infants, so these are babies who weren't born early, who are born healthy, die before their first birthdays in the US because they were not exclusively breastfed every year.
Wow.
That is a low rate, but what if one of those 720 was yours?
To all of our listeners out there, you're listening to What's Health Got to Do with It on WJCT News 89.9. I'm Dr. Joe Servant, and if you're just joining us, we are talking about the importance of breastfeeding, and we want to hear from you. If you have an idea for future shows, tag me on social media at jservant. Dr. Taft, I know you've authored the Ask IFAS guides, and in there you also talk through some of the things you just highlighted, known health benefits. I'm just wondering, why do you not think, as you said, breastfeeding is the human default system for your baby? Why do you think that people don't appreciate as much how beneficial breast milk is in lowering risk of asthma, diabetes, and sudden infant death syndrome, or SIDS? Why do you think that's not as understood?
Oh, goodness. I think this is sort of very complex culturally, and I could probably give you a full 30 minutes just on this someday. But at a baseline, we had a cultural shift at two different periods in our history in the 1930s and the 1970s, where we got very into sort of manufactured, man-made things, and it's the latest, greatest, and the best, which gave a perception of formula as scientific in a way that really hurt breastfeeding rates in this country, which also means our culture shifted to see formula feeding as the baseline. And I think Florida has a lot of fantastic people trying to do education and trying to do outreach, but we need to be doing more. And the way I wound up writing these pieces is I was working on a research study, and I was going into UF Shands to try to recruit for my study. And I walk into one particular room, and this is someone who has told the nurse that they're planning to breastfeed and they'd love to talk to someone about a breastfeeding research project. And she's feeding her baby a bottle of formula. And I sort of looked at that and went, are you planning to breastfeed? Because I thought maybe I'm seeing things wrong and this is breast milk, not formula, and it's just a weird bottle. And she goes, oh no, I just told the nurses that so they would leave me alone. And I went, oh, I guess you're not interested in the research study. And she said, no, not at all. Thank you for your time. And off I go. And I knew IFAS did a lot for nutrition education. So I went, I'm going to go to Ask IFAS. I'm going to pull up the information we have on breastfeeding. I'm going to see what I can do to help promote that information. We had nothing. And I went, okay, I guess I need to start by writing these and then trying to promote them. And there's just a gap, even with all the wonderful people who are trying to do this work in Florida, in reaching out to make sure that the women who are having the babies and their partners and their families understand that sometimes breastfeeding is a life or death decision. Sometimes it's about preventing asthma. Sometimes it's about preventing wheeze. And if you don't know, you can't make an informed choice. So that is just the gap I'm trying to fill with this.
Understood. I'm going to kind of ask, I know you're saying there's a lot of work to be done here in the state of Florida, and the US for that matter. Um, what kind of support do you think, like if you had to do one thing, and I know there's more than one thing, but what kind of one thing do you think would make the biggest difference in helping parents who want to breastfeed succeed? What would you tell policymakers and other folks that this is what would make a huge difference now?
So maternity and paternity leave for the policymakers.
Okay.
The families who are actually trying to make that choice know that you have support available to you. There are international board certified lactation consultants. So that's the ilca.org website. These are people who have the highest level of training in breastfeeding. They're the ones with the practical knowledge to actually help you figure out what's going on and what's going wrong and how to fix it before you run out of the time window where you can really get lactation going. There are groups like La Leche League and Breastfeeding USA. They have peer counselors. They have people who can help support you and figure out how to breastfeed successfully. So for individual families, know that there is support available and reach out as quickly as you can, because again, it's a crisis. So the sooner you act, the more likely you are to succeed, and there is help available.
I want to give you an opportunity to dispel any myths that you often hear that discourages breastfeeding or makes parents feel like they're not doing enough. What's that one thing or two that you think just needs to be corrected on the record about the myths regarding and surrounding breastfeeding?
Well, I'm glad you gave me the opportunity to give two. So the first one is about sleep.
Okay.
People say if you're formula feeding, your baby will get more sleep at night. Well, actually, when people went in to study how much sleep parents got at night, the exclusively breastfed parents averaged 30 minutes more of sleep per night.
Really?
So the exclusive breastfeeding does better. We don't completely know why, but I suspect it has something to do with not always having to get up and heat the bottle
Sure.
and clean the bottle and sterilize the bottle and then go back to bed. And you just roll over, you pick up the baby latches, and hopefully you don't live through what I'm living through with low supply issues.
Okay.
Because man, that's a heck of a lot easier than getting up and dealing with the bottles. And the other factor is likely that breast milk does change in composition over the course of the day. So it has components that are produced in the breast milk at night that help the baby sleep. The second one that drives me nuts, especially right now because I'm living through it, is about diet.
Okay.
Where 10 to 15% of lactating people will be told to consider a restricted diet. It actually helps in about 2 to 3% of cases, and they're usually clear symptoms of when it's going to help. So that's things like if the baby is wheezing, if the baby's showing symptoms of eczema or allergic disease, God forbid, mucus or blood in the stool, if the infant actually has gastroesophageal reflux disease and isn't just spitting up, because babies do spit up, then a restricted diet might help. But for goodness sake, let's not tell all the mothers you have to give up dairy and you have to give up soy, because what you eat is going to influence the composition of your breast milk. So you want the healthiest diet you can manage, especially since helps induce tolerance and reduce food allergy and picky eating in babies later. So let's keep moms as diverse of a diet as they can, as long as the baby isn't showing clear clinical signs of something that needs to be addressed.
I love this. In our last moment here, Dr. Taft, I want to give you another opportunity to address the audience. This is breastfeeding is always, like I said, it's a complex issue. You just point out Florida is the 48th state in the nation with regards to breastfeeding issues. What's your best advice to potential parents, new parents, whether they're breastfeeding or using formula or maybe doing both, who just want to make the healthiest choice they can make for their baby. What do you want to tell our listeners out there? Any way you want to frame it.
I'm going to give different advice for each category.
Okay.
So for those of you who are formula feeding, if you can't breastfeed, you can't feed breast milk. It's not your fault. We could live in a country where there was so much donor milk and it was such a part of our culture that if you were unable to breastfeed, you would get donor milk delivered to your door for the cost of what formula is in this country. That's something as a society we have chosen not to do, and it is not your fault. For mixed feeders, hey, you've got some breast milk. That's really, really hard to do when you're mixed feeding because breast milk often responds to supply and demand. So go you. This is not an all or nothing. Every little bit of breast milk you can get into that kid helps, and you're doing the job, and it's tough, and bravo. Keep going. If you can build supply, build supply. I know it's hard, but you're doing it. For those who are exclusively breastfeeding, congrats. You've got it. You're feeding your baby. You're feeding them the best diet you can. Keep going as long as you can. And if you are fortunate enough that your milk issue is oversupply, consider donation.
I love this advice. I want to thank you, Dr. Taft, for your wisdom, insights today. And let me once again congratulate you on your newest addition to the family and for giving us your time during your maternity leave to talk to us today on the show. We really appreciate it.
Thank you for your time. I've really enjoyed this.
We've been talking to Dr. Diana Taft. She is an assistant professor of food science and human nutrition at the University of Florida. Well, that's our program for today. We hope you've enjoyed our show. If you missed anything, you can listen to the full episode at wjct.org and on your favorite podcast app. Thanks to all of our guests. Our executive producer is David Luckin. Stacey Bennett is our producer. Brady Corum is our director. Caden Collins is our researcher. If you have health questions about this or any topic, let us know by calling us at 904-358-6362. Email us at health@wjct.org or tag me on social media at jservin. I'm Dr. Joe Servin, and you're listening to What's Health Got to Do with It on WJCT News 89.9 Jacksonville. Thank you for listening, and stay in touch.
Support for What's Health Got to Do with It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org.
Rethreaded needs you to make a difference in the lives of human trafficking survivors. Learn more about supportive services and an array of survivor-made products at rethreaded.com.
And by Neurelis, a leading neuroscience company focused on the development and commercialization of therapeutics for the treatment of epilepsy and other neurologic disorders. The company's unique drug portfolios strive to address unmet needs in patient care. Learn more at Neurelis.com.